Welcome to the Cup of Nurses podcast.
Welcome, guys, to the Cup of Nurses podcast with your hosts, Matt Slarchuk and Peter Findero. Welcome, guys. This is a podcast where we tackle current health news and hot nursing topics one conversation at a time. How you doing today, Peter?
I'm doing great. Have my coffee. It's noon, a little late on schedule, but it's okay. Couldn't sleep, but it's okay.
Yeah. Welcome, guys, to the show. For anybody that's listening, thank you, guys. Give us a rating on Apple, Spotify, whatever you guys are listening to. Those that are on YouTube, thank you. Subscribe, ring the bell there. Comment. We hang out on the comment section afterwards the show to kind of interact with the audience, so check that out. And we're going to be creating more little shorter videos for anybody that's on YouTube. It's gonna be like tutorials and a lot of specific topics, so definitely don't miss out on that.
Yeah, we're going to try and get into a sim lab, maybe like Matt said, go over some tutorials and how to do certain things like NG tube insert and things like that. But we'll see how that works out. We got to reach out to some hospitals and see if we can use our sim labs.
And I really want to stick an NG tube down Peter's nose, so I'm just waiting for that moment.
Hey, we can wait all you want, but I call it rectal tube.
That would hurt. You know the little balloon thing that goes in?
Oh, hey, it's what the fans want, you know.
We'll
gotta
see.
do it.
If there's enough people, I'll do it for the fans.
Noted.
So today we're going to talk about healthcare, how essentially it's just a multi-billion-dollar business, and for this upcoming election, Bernie Sanders might be the guy that could solve this healthcare issue. And also, we're going to talk about how there's evidence on optimism linking to longer and better sleep.
Yeah, optimism is key to optimal, mental growth and just mental health and just health in general. We all are vulnerable to those days where, we're not very optimistic. We have those bad days, which is okay. But in the long run, if you're more optimistic, you do have longer and more restful sleep.
And unfortunately, as you get older, I feel like you are less optimistic because you just have nothing to look forward to. You're looking towards disease, hospital visits, and dying, unfortunately. It sucks.
Yeah, work piles up. You have kids. It's stressful. The stress adds on as you age. And unfortunately, a lot of times we don't know how to cope with it or deal with it. But being more optimistic does at least give you better rest and sleep.
Definitely. And what is your viewpoint on healthcare, Pete?
Healthcare, I feel like in the United States, it's very privatized. We don't have lots of regulations going on here. A lot of countries, as we see on the news, they are switching over to more of like a one-player system where it's almost government-run. And maybe it's probably time for us to switch over to that sooner than later. It's just costs are kind of out of control for the most part. And even though with Obamacare did open the market, an insurance market for a greater audience, but it didn't really tackle any of the costs. People are still overpaying for insurance, and it's just such a costly thing in America. And it's just for our health, something that we're almost granted, by our creators.
Just like people are saying that healthcare should be a human right. We all should have accessibility to it, not where you have to be on an insurances plan and things like that. And, later on we're going to touch about healthcare itself and just really look at the root cause of what's going on and dive deep to see how hospitals are making money, how big pharma's making money. It's a business, unfortunately, and it's sad that we're the front line and we care for patients, and it sucks that people above us and these head of hospitals, they don't have the same opinion about it, and it's just money, man. It's numbers, and if things aren't acting up, we got to cut costs and do stuff to make money.
Yep, it's crazy. Our health is a business. The way we pay for things, it's all business. It's all just to make money. Yeah.
Let's bounce into the current health news today. So today we're going to talk about how optimism is linked to longer and better sleep. So according to the Central Disease of Prevention, Control and Prevention, in 2016, they came out a statistic that 1 in 3 Americans, adults, fail to get adequate sleep, and it's escalating the risks of chronic disease. And as we know, sleep is one of those number one personal care things that we should prioritize, and we don't. I feel like if you got to get, shit done in your day, you're going to sacrifice sleep.
It's very true. A lot of times we're going to bed late, and we had so much to do today where it's dragging on to the next day when we go to sleep at 1 o'clock, 2 o'clock in the morning, and then we also are so forward thinking that we have so much to do the next day. A lot of times we wake up early too. So instead of sleeping from 10 to 7 o'clock in the morning, we sleep from 2 o'clock in the morning till 6. You sleep for 4 hours. You get up because you want to finish your day off earlier than the night before.
That or like sometimes you're thinking about so much you have to do or so much that you did. You have insomnia, you get a little anxious, and you just have all these racing thoughts. Everybody has them, and you just can't fall asleep. And then you keep tossing and turning. You tell Alexa to play some random music. That doesn't work out. Hopefully she doesn't turn on right now. And it's a bad cycle, man, and we have to prioritize sleep.
Yeah, it's hard because, like you were saying before, it's just so much that we have to do today and tomorrow and then the next day, where a lot of times we feel like we're playing catch up every day, and we're catching up on the work we got to do during the day, which means we need more daylight and more time to work. And then again, at the end of the day, we're trying to catch up on sleep, and we're cutting, our sleep schedule by 1 or 2 hours, and that has shown in the long run to be unhealthy.
Yep.
And that's people expect. They want you to stay at work late and then come in early, while the CEOs or whoever, is running the show comes in whenever they want because they don't have a schedule. You have your own schedule, so you always want to do more. So you have less for the next day, but you never seem to catch up.
Yeah.
And then your sleep's also paying for it as well.
Definitely. So this study, it took 3,500 people, ages 32 to 51, and the study sampled people from Birmingham, Alabama, Oakland, California, Chicago, and Minnesota. So these participants had like a little survey, 10-item survey, and they were ranked on a 5-point scale about how optimistic you feel about your future, or how. And then they had a survey that showed a very negative response of I hardly expect things go my way. They ended up doing different sleep studies. So these people came in on 2 different occasions, a year apart. Over the weekend, they did sleep monitoring on them and just seeing how they do. They rated the overall sleep. They also checked the quality, the duration from the month prior, and took all this into consideration. And the results were pretty interesting. So 75% people were more likely to have better sleep, less insomnia, and less daytime sleepiness if they were more optimistic. So the results are optimism equals better sleep.
That's pretty drastic. What if it's like flipped around? What if more sleep leads to better or more optimism? I'm sure there's like a study out there.
I'm sure they're both correlated, but definitely you being optimistic about the future leads to less stress, which stress we know is bad. And then being optimistic, I feel like it just makes your life easier, to be honest.
It makes sense. If you're optimistic individual, that means you probably get done whatever you have to get done that day, and you probably go to sleep happy. And if you go to sleep happy, instead of being stressed or angry or having your mind race, you fall asleep quicker, you fall asleep easier, and then you sleep longer. Just because, like you said, because you're optimistic. That makes like legit sense. If you go to sleep happy, and with everything being okay that you did that day, you're gonna sleep better because you have that peace of mind.
And then also like the law of attraction. If you have like a negative outlook on your future, then everything around you will start becoming more negative. Everything will start affecting you. That little thing pissed you off, and everything is just like one of those domino effects. So I feel like when you're optimistic, for some reason, the universe just brings positivity in your life in a way, and everything just seems to be working out. Even if it's not working out, you make peace with it and you just move forward. You know what I mean?
Yeah, just a sheer optimism is provides more benefit than being negative. Like think about it, you go to the club or you go somewhere, you see like a pretty girl and you approach her and talk to her and you get shot down. An optimistic person would view that as like, it's whatever. It's a game of numbers. If I don't get this one, I'll get the next one. Compared to someone that's negative, be like, oh man, it's my only chance, and then they go home alone and sad. Compared to, like we said, optimistic person that's gonna keep trying and have a good viewpoint. It's the same outcome, but just the way you look at it. You look at it either one as it's negative and it's always gonna be like that, or a positive way where this just happens. That's how it works, and you just gotta keep trying.
Couldn't have said it better myself. Peter right here was his past career. He was a pickup artist, so he knows the game of numbers.
Yeah, about a senatorial, those videos that we talk about on YouTube, or is that Patreon, or some private coaching or something.
Yeah, Peter doesn't do private coaching. He's gonna have a little secret cam in his shirt, and he's just gonna be showing you guys how it's done out there.
Yeah, I don't know what the proof rating in that for my girlfriend's gonna be, but I can probably tell you it's gonna be 0.
Yeah. Don't do it. Dalai Lama had an interesting quote, and he said, choose to be optimistic, it feels better. And it makes exact sense, based on this study. And what do you guys think why optimism is linked to better health outcomes? So comment on IG or Facebook or drop a YouTube comment, guys. And I'm curious to see what people think.
Yep. You want to touch on healthcare now?
Let's do it.
Yeah. So you guys know that election's coming up in 2020.
Before we start, we should let you guys know this might be a little bit dry. We'll try to make it fun, but we promise you guys, if you guys sit through this episode, you guys will learn a lot about healthcare.
Yeah. So you guys know that election's coming up in 2020, and the Democratic Party has different viewpoints on what the healthcare system reform should be. But before I talk about that, when we hear the word bankruptcy, a lot of times we associate that with somebody with like poor credit, someone that doesn't know how to manage money very well. But actually, since 2007, the number one reason for bankruptcy is due to medical expenses. So our healthcare and the cost of healthcare is so expensive that people are literally going bankrupt. They're mortgaging their house. They don't have enough money and no way to pay for their medical expenses, which is insane. I feel like it's not talked about a lot. Like I said before, a lot of times when you say bankruptcy or someone that's bankrupt, it means they're poor managing money.
Yeah.
But the truth really is, what's causing people to be bankrupt is the sheer expense of healthcare. Those hospital costs, cost of medications, and that just all ties into this one giant, hole of debt that people get lost into.
Do you know the statistic on the amount of percentage of people that are getting bankrupted because of healthcare?
It's in the 30s or 40%.
30-40%.
Out of all bankruptcies, yeah.
Wow.
That's pretty crazy. And it might even be up to 60. So it depends. I looked at a few articles, and some said 30, some said 40, and like one or two said 60, which is insane. And there's multiple ways of getting bankrupt, but medical expenses is the number one.
And it's interesting because some people, like let's just say you're type 1 diabetic and you can't afford insulin. Like these people think that using less insulin and injecting themselves with less units because they could hold over that insulin, it'll last longer, is saving money, but it's really ruining your health. And a lot of people don't realize that, and then they come in the hospital and we're chopping off toes and metatarsal, below the knee amputations because the sugar literally ruin their nerves and everything else.
Yeah. So why is healthcare so expensive here in the United States? Well, the United States spends more than any other country on healthcare. In 2017, it was $2.5 trillion went into healthcare, and in 2020, they're predicting to be in between 6 and 10 trillion. So in 2017, it was about $10,000 per person that they spent on or spent on healthcare, and we have suboptimal results. Like we're like 11th in the world with our healthcare outcomes and just our healthcare system, compared to countries that are spending half of that are like 5th, 3rd, 4th. I believe this like number 2 country with the best healthcare, I think it's like I don't know if it's Switzerland or Sweden. It's like a smaller country, but they spent like 8,000 compared to our 10,000, and they have better outcomes than us, which is, if you think about it, it's a smaller country, so it's easier to deal with compared to the U.S., but you would think with all the money that we're spending and throwing into healthcare, we'd get, optimal results. We're paying a pretty penny, a high premium for all this healthcare, and we're not even like top 10 in the world, which is pretty breathtaking. Another reason why it's so expensive is administrative costs. So we don't have a one-player system. So each health network has their own way of doing things, and just the communication between these health networks costs money. Each health network has a different way to do payroll, different way they do billing. The privacy and security within these systems also varies between them. Like my hospital has a different system than yours. Even the charting is different. But charting isn't really that big of a deal because it's easily implemented. But the fact that the administrative costs are so big with communications between our hospitals and sending my information to your hospital is just so costly because there's no bridge between them.
And it happens so often when you get a patient from a different, hospital that we've never taken care of, and the doctor is like, well, what's going on with this guy? What's his history? What kind of tests have he done? Because why should I do a CT scan if he had got a CT scan done 2 weeks ago and he had surgery at, let's just say, Good Sam, and now he's at Christ, right?
Exactly.
So those are all because of universal health care. Because there isn't universal health care, like we're eating up all these costs, just like you said, for all these administrative issues.
Right, and we have all these health systems, and patient usually comes with what? A paper chart. They have a stack of paper information that's not even in the computer, and physicians look it over and they end up running the same test on them anyways. Another reason why it's so expensive is Americans, they go to hospital before they would see a doctor. So that's another issue with prevention. A lot of times we give poor education and people don't really want to see a doctor. They think health is something that should be tackled once it arises. So instead of me checking my blood pressure now, I'm just gonna, deal with it whenever I get a heart attack or like a stroke. When things get bad, that's when people tend to see a doctor, but that's when it's too late. They got to go to the hospital, usually the emergency room.
Yeah, we in America have neglected prevention of, and prevention of is probably the most cost-effective treatment and way to reduce healthcare costs, and we don't do it. We should be doing like free healthcare screenings, like we did it even for nursing school, where we did free blood pressure checks on people and just kind of talk about blood pressure. Like that should be implemented on a big scale in America because that's going to help, and it's not done. It's all CT scans, visits, lab tests, and take a pill, and that's just healthcare in America, man. It's sad.
It's sad because there's no profit margin for it. There's no profit in prevention. Like I could be a doctor, I could tell you, hey, go on a run and you could lose some weight, or I'll just prescribe you a pill that you pay for, and then I get like a kickback for it or a percentage of that money, which is crazy. Like something simple like that, like hey, go on a run, change your diet. That doesn't happen. It's usually like a pill. Someday you got to pay for a program, even like workout programs. Like people buy these workout programs and they end up not doing them and they waste their money, or they do end up doing them and then like it turns out that I could have probably just thought about the same thing and done it my way and would have had the same results.
Yeah, and also all these drugs, tests, and services that the hospital provides. All these physicians are like scared for getting sued and everything, right? So they want to I think they overdo things. They overtest, they overscan people. We get too much radiation. And for what? It's not necessary, but the doctor wants to cover all the points because let's just say something happens, God forbid, he's getting the one pointed at and they're going to take the dent, because I feel like this is like a new thing, right? Like we like to sue people for anything nowadays.
It's crazy to think about. Like when you go see a doctor, a physician, like 99 times out of 100, the physician has your best health in his mind. He wants to do everything in his power so that you come out healthy and not sick and not diseased. And it's crazy because people take advantage of that, and they take advantage of people's kindness and people's need to help and certain things like that, where they're gonna find loopholes or they're gonna try and beat the system, where they're gonna trick somebody into making a mistake or not doing something that they should have been done, and then they get sued for it.
It'd be funny if you tell this little story about the Oakland guy that came in for the stroke, man.
Oh man, yeah, the Oakland guy. So I had a patient. We were at like a stroke center for the most part for our trip in Oakland, our travel nursing gig, and so we had this patient. He was a reverend from, I think it was Louisiana or somewhere, and he came in with stroke symptoms, and first he started having left side weakness. And then he was admitted to like a general medical surgical floor just for observation. And then he presented with like a full-on stroke, facial droop, left side weakness. All that did a CT. It was negative. They weren't sure what's going on, so they just took him to the ICU. And I happen to have this gentleman, nice guy, but I did my NIHS scale every hour that I was doing it at that point, and he failed all. Facial droop. All left side was drooped, couldn't move his left hand, left leg, nothing, couldn't do anything for himself, mumbled, and then 6 o'clock came around, he had his breakfast or whatever, and all of a sudden, I want to sign myself out AMA. How can you sign yourself out AMA?
That means against medical advice, guys.
Yeah, so he's going to sign paperwork and he wants to leave. I'm like, how are you going to sign yourself out AMA? You can't even walk, you can't even stand, you can't even move your left side. Your speech is slurred. And I mean, it was slurred, now you're talking fine, but move your left side. Able to move everything. Stands up, jolly guy. I'm like, all right. I'm like, this is ridiculous. Like, this guy faked a stroke for like literally like 24 hours.
Did he get TPA as well?
He got TPA as well.
Wow.
Yeah, when he came into ER, I forgot to mention that, but he got TPA. And then this guy faked his whole stroke for like 24 hours just so he could eat and just so he could have somewhere to sleep. And I kind of had a feeling that he was lying because at around like 2 o'clock, I came in, like his left leg was bent, left arm was bent. I think he fell asleep, and subconsciously moved his
Right.
left side, and I was like, all right, this is how it's gonna be. Whatever. I had a feeling he was faking him. That means you get the 12 hours or 8-hour shift done with, and then we'll go home. And this guy, 6 o'clock in the morning, science file AMA, walks out, gives me attitude. I asked him literally, hey, do you have all your belongings? Because, you can leave now, your taxi's here. He's like, yeah, I'm not. He said he's not stupid. He called me stupid for asking him, and then the dude forgets his check.
That's so funny.
Dude forgets his, $1,000 check that he's supposed to cash. Man, it's funny to think about.
This is healthcare sometimes.
Right.
We spend money on these people.
Right, and then I asked my charge nurse, who covers the cost in that case, because I never had a patient, walk out AMA after he just got TPN and supposedly had a stroke. And he's like, nothing, the hospital's going to cover the cost. It's like shit, that's pretty expensive, man. I'm not sure how much TPA costs, but I'm sure it's thousands of dollars. We don't give it out like candy.
Right.
And this guy took out an ER bed, a medical surgical bed, and an ICU bed, all in with 24-hour period.
And I think the average price for an ICU bed, I don't know. I think in Illinois it's like $10,000 a night. Yeah. So this guy is eating up costs.
Yeah, it's insane. And then he's gonna give me attitude. Why I'm taking my time getting his paperwork together. Man, go home, dude.
I mean, sometimes in nursing, man, you have to laugh at the things you see because it's just the funniest thing, man.
And it's funny because I closed the curtain, he got dressed, came out with a blue suit and a white top hat.
Damn.
I'm like, this guy, dude, Reverend right over here or whatever his name was, man. It's funny guy. What a goofball.
That's funny.
But it pissed me off a little bit though. Yeah.
So
and he came back too for that check. I wish I would have gave it to him, but I didn't give it to him. The one of the managers gave it to him. I was like, you feel better that quick, huh?
That's sad. So next topic, guys, is universal health care a good idea? Because we know the time of Obama came in, Obamacare would help and enable, better price cuts and deal with all these big costs that are happening. And did it do much? I'm not too sure. I know it opened up the insurance market for a lot of people that signed up that are uninsured, but it didn't solve the issue of a better healthcare system, did it?
Yeah, that's correct. It didn't really do anything to the cost or effectiveness. It just kind of signed up more people for insurance for the most part, and then they're kind of stuck paying for it. The government doesn't really pay for it. So you have all kids or Medicaid or Medicare, things like that. But Obamacare just basically opened up the door for more people to get insurance, but nothing with cost for the most part.
Nothing better. And is Bernie going to have a different approach on things? Because you kind of did some research on that.
Yeah. Well, the whole Democratic Party for the most part is pushing for Medicare for all, so a single player system. Bernie's stands out the most out of all of them. I guess it has the most support on the Democratic side than anybody else. I think it's 14 people co-signed it. So that's a lot, I guess, in the Senate. I'm not sure how the numbers work, but his is more popular than whoever else's. And that's kind of his plan is basically the main plan for the Democratic Party, unless somebody else wins. But I don't see that really happening. But he proposes a medical care system for everybody. So the way we would pay for this is, how you have income tax and the federal and state tax your income every weekly or bi-weekly or monthly. There would be a Medicare tax for that as well that would be taken off your check, which a lot of people aren't happy about. But if you really think about it, you're paying a large sum for healthcare anyways for insurance. That money, instead of going to the insurance companies, it will go to the government, and they would disperse it as they need. So it's the cost, I'm sure, is going to be a little bit different for everybody. Some are going to pay more than they pay now. Others will pay less. But that's the point of having a government-funded, healthcare. People are going to pay more. Some are going to pay less, but everyone gets it. And this insurance, it's you're going to be mandated to sign up for it. Everyone's going to be signed up for it no matter what.
So will it be only one insurance company? There's not going to be Blue Cross Blue Shield, or will people still have private insurances?
So this Medicare for all that he's proposing, it's going to tackle hospital costs, certain medications, doctor visits, all that. But you could also opt in to buy your own private insurance. So cosmetic surgery, certain drugs, those you could either pay out of pocket for, or you could buy another insurance to back up, the government funded one, which kind of makes sense. As long as insurance, or let's say as long as Medicare covers the basics of health, and hopefully it incorporates some prevention into it, I think that's going to be better than it is now, because insurance costs and healthcare costs are just ridiculous to the roof. I don't see it getting any worse. And to be honest, I'm willing to pay a little bit more if I have to, just to get like a flat rate for the next like 10 years. Because every year insurance gets increased. You always pay more every year for insurance. Medicare expenses always cost more year after year, and it just keeps increasing, keeps inflating.
That, or you hear about like deductibles are increasing, or now it's like my insurance doesn't cover 100%, it's 80-20. So after like, what is it, $5,000, I have to cover that 20%. It's just silly, man. Like these insurance companies are literally like manipulating little prices. You hear your healthcare system, your hospital is changing its insurances. Like, what's going on?
Right. Like even like when insurers figure out these costs, they're the ones doing the negotiating, and each insurance does its own negotiation. Each company, they don't have one set price for everything.
Standard.
There's no standard of cost or anything like that. They just negotiate. You know, certain insurances are going to give you more coverage on medication compared to certain companies that are going to give you more coverage on hospitalization. And there's no medium ground. Everyone just kind of does their own thing and negotiates for themselves. And then with this system, the Medicare for All, there's no co-pays and no deductibles. It's just that one flat, weekly or monthly or whenever your income is, and you basically get taxed on that. And nowadays there's even like we talked about before, there's different healthcare systems, different insurances. So I have one insurance and I can't see this physician because he doesn't accept my insurance. It's like why? What's the difference? It's insurance. I'm insured. I'm paying for it, but he just doesn't accept it.
Or sometimes you switch your jobs and the physician will basically say, I can't take you anymore because insurance changes.
Yeah.
So that relationship that you just created with the doctor, all the things that, he knows you inside out in a way, and like now you can't go see him because he won't take you.
Right.
Like I had this issue with my grandma when she like switched to like Aetna from, I don't know what insurance it was. That's so sad, man.
Right. Medicare for All kind of breaks that gap between somebody with less quality insurance compared to somebody with higher quality insurance. You could go see anybody and everybody. And there's still going to be a private aspect to this. I guess medical facilities are going to decide on how much to pay each person or each worker, or how it's going to work. But the numbers aren't really set yet, or they haven't been announced. It's something that, you gotta work with once you become president to have a full grasp on the situation for the most part. But, if Medicare for All offers, healthcare for all, and it's quality healthcare and it cut costs, then why not go for it? Countries like Canada have been doing it, and it's been working out for them. A lot of people complain that there is going to be a lot of wait time, things like that. But I feel like here in the United States, it shouldn't be that big of an issue.
We have the system in check. I feel like
it shouldn't be that big of an issue. We have so much growth for medicine and technology that it's going to be way more efficient here than it is everywhere else, just because of all technology and the way we've been doing things. So a lot of times the private sector things are going to carry over to like the government sector.
So definitely, if you're choosing your candidate for the next election, if you're able to vote, if you're registered, make sure you choose a person that's for a better healthcare system, because that's a huge issue in America right now.
Yeah, people are profiting off your poor health. That's ridiculous. And there's no regulations. They could charge whatever they want, and no one's going to say anything about it.
People are going to jail for holding a couple grams of marijuana and stuff, and you got people that are literally profiting off sick people, and these people, we can't go after these people.
Right.
That's so sad, man. So next topic, prescription drugs and drug manufacturers. These guys are the real ball players here, man. These guys are making millions of dollars from us, if not trillions. So our healthcare system in the United States is twice as expensive as in any other country. Why is that? And healthcare is a $3 trillion system. And if you were to compare it and ranked it, it's the world's fifth largest economy.
Yeah, that's crazy.
According to Consumer Reports.
Right. Our healthcare sector has more money in it than countries have in their whole country. That's crazy.
Yeah, and the World Health Organization actually ranked our healthcare system based on all the statistics and whatever they do, and it was actually ranked 37. So we got this number one nation. Everybody's proud to be American. We have the freaking military-industrial complex where we could just kill any freaking country like this, but we have a healthcare system that's basically fraud, man.
Yeah, we pay a premium cost for a suboptimal system.
Yeah. So I'm going to be the devil's advocate here, and I'm going to talk about Big Pharma a little bit. So the question is how much does it cost to develop one drug? Because it is expensive. So these pharmaceutical companies, it takes a lot of time, research, clinical trials to make a drug. On average, it takes 10 to 12 years, right, to design a drug, to develop it, the approval for it, and to market it. So it's a long roadmap. I understand that these companies are upcharging us, but the question is, like, is it fair? So one statistic was that one successful drug costs up to $2.6 billion to market. And a lot of these drugs fail, right? I think over 90% sometimes don't make it.
They do. That's how it is. But a lot of times they have a cushion. So a lot of these drugs, since they're so expensive to make and it takes so long to create, a lot of these drugs are subsidized by the government. So the government dishes out the funds and pays for a large chunk of the research, which then they get back once the drug gets approved or hits market. And unfortunately, like you said, 90% of those drugs fail. So 90% of the time, the government's not getting their money back. And once these companies create a drug that proves to be effective, they basically sell it. They have a patent for X amount of years. They sell it, they pay the government back, and then whatever else they make off of it goes to the company itself.
That's profit, and it's not controlled. It's not regulated. We don't negotiate prices. It's just...
Yeah. So the government helps them out to get this drug in market and prove that it works, and they get no compensation. They just get the money back that they brought with. They don't get any kind of percentage. They don't get any kind of say on how much the drug will cost. Nothing like that. The company has full control of that drug.
And even Bernie said that these pharmaceutical companies are spending more money on marketing and advertising, just like in our TV ads, than actually putting money into the research to develop and create a better drug for the future.
Yeah, like you were saying, let's say a drug costs $2.6 billion, to bring to market. So they cost them that much money. Let's say they make within their first year $3 billion. So they made already a $400 million profit. That all goes to the company, and whatever the company wants to do with it, pays employees, great. But there isn't a limit on how much profit they could take. There's no laws or nothing that says you could only upcharge 10%. So they could bring the charge up 100%, and next year they can make $6 billion.
It's
$12
like,
billion.
It's like that company that like raised the EpiPen. If you have allergic reaction, like 400%. Like, who's the one that's driving the price margins, man? And there's no regulatory body for this, so they're able to do it, and we have to just eat up the cost, man. And AKA, these are the insurance companies. So, like, whether we like it or not, whether we like to admit it, our healthcare system is a business, and it's about making money. We care about patients. The big guys up there, man, it's a system, and let's evaluate a few things. So let's talk about insulin. The cost of insulin is skyrocketing, right? And on average, a type 1 diabetic, the average cost in 2012 for insulin was $12,467, right? So 12.4K. In 2016, that cost went up to 18.4K. So now it's greater. Why? We have to start looking at this, like, where are these, prices coming up? And many individuals are stuck with insulin, and just like we talked about, they're going to give each other a smaller dose to make it last longer, and in reality, they're ruining their health and their outcomes, creating chronic problems, leading to death, rehospitalization. Like, that is sad, man. And we're pinpointing people in this position, man. I have chills. God, yeah. You're so passionate about this topic, huh?
It's unbelievable. Like, to address the cost, like you would think that the more you produce a certain medication, you're gonna be able to adapt and produce more of that at greater efficiency. Like Tesla cars, you could give, for example, as another reference. They're expensive, but the cost decreases over time because as time goes on, they become more efficient. They find new materials, and the car eventually gets cheaper. Same with medication. Like, how does your drug price increase from 2012 to 2016?
When it's the same drug, nothing was changed or anything else.
Yeah, you'd think you'd be more efficient at making it. You had a 4-year time span. You would think you kind of create a machine that you could automate it, or it's going to be. They for sure have made production of insulin more efficient. They just upcharge it because they can. Like you said, there's no regulatory body. Yeah, there's no regulatory. They can charge whatever they want. And if they have a patent on it, no one else has a recipe. You could do whatever you want.
That's messed up.
No generic brands, of your medication at all. So you're in complete control.
Yeah. Another drug, to give you a perfect example, Humira. So it's an immunosuppressant drug. It treats arthritis, psoriasis, Crohn's disease, and ulcerative colitis. Great drug for a lot of people. My grandma, she has issues with arthritis. She takes Humira injection. Her joints feel better and everything else, right? But she had an issue with insurance because it costs so much. So, very popular drug. In 2015, that drug has worldwide, people have spent $14 billion on that prescription. That is, per statistic, the whole economy of Jamaica. That's how much that one pill or drug profited. And give you another statistic. Let's just say you're a doctor in the United Kingdom. Humira prescription will cost an average of $1,300. If you're seeing a doctor in Switzerland, that drug is going to cost you $822. If you're in the United States and you go see your doctor, that prescription is going to cost you $2,600.
It's like twice what it costs somewhere else.
Yeah.
I hear a lot of times people going to Canada for prescription drugs like insulin because it's like almost a third of the cost, which is ridiculous. And the reason being is for those countries, the person that negotiates the price of these drugs is the government. There's one body that negotiates the price for everybody. Compared to here where, insurance negotiate and, you get positives and negatives with certain companies. And a lot of people argue that, a lot of these companies argue that we pay a premium so other countries can have a less cost, which I find is complete bullshit because after a certain amount of years, you're taking all the profits. So that argument is completely ridiculous. And people are pushing for, globalism and equal economies all around. Like, how is this fair? It's really not fair.
It isn't. And the topic of is there regulations on prescription costs? And in, unfortunately, United States, that is one of those things where we do not regulate drug prices. If a new prescription comes out, it's considered safe, boom, it's on the market. Compared to other countries, let's just say Australia or something. So they actually have a government that will meet up with this pharmaceutical company and they're going to compare prices. They're going to negotiate them. They're going to first see whether it's even worth bringing out to the market. They're going to compare other treatments and see whether it's more effective. Because what's the point of bringing a drug to the market in Australia if it's not any better than it already is? Like Australia literally, I think, refuses half the cancer drugs that are in the United States because they don't see it being any effective.
Yeah.
And the United States is the only one that the drug makers are setting their own costs. So if you're in Australia, you're negotiating, the government is negotiating the price of drugs. They set a price, that's it. In the United States, there isn't a government regulatory to negotiate any pricing on prescription pills. What happens is the drug company sets the price, then they negotiate between insurance companies. That's crazy. So different insurance companies are going to have a different set point of the price of specific prescription pills.
Right. You're not even picking the drugs you want to take or the brands. No one ever presents you like, hey, these are 4 blood thinners. This is the price for each of them. Which one do you like? Here are this is the cost analysis. These are the pros. These are the cons. You can choose. No one says that. Is your doctor gonna give you whatever the insurance negotiated with the company? If insurance company gets a better deal with Xarelto, you're gonna be on Xarelto versus Coumadin. That's just how it works. It's crazy. You don't see any of this.
And you don't know whether that pill is more effective or not. It's just what your insurance has negotiated. That's a treatment that you're
right.
using.
What it covers.
So that's one corrupt system we have to fix. We have to make sure our healthcare system is more regulated by the United States government, where the United States government is freaking talking to these pharmaceutical companies or negotiating prices. Just like in other countries like United Kingdom, Switzerland, Australia. Not freaking free reign in America and they can do whatever they want.
Right.
And unfortunately, we have lobbyists, which, these pharmaceutical companies are paying millions, billions of dollars to sway things their way to make sure things are the way they are here because they're freaking making tons of money.
Yeah. The thing about lobbyists are very strong. Like, there's a reason why cigarettes still exist. It's just lobbyists. That's the reason why cigarettes have been shown to be healthier or produce no harm in the past. Just lobbyists, just because they were able to sway, people that are in Congress or in the Senate or House of Representatives. They were able to sway their opinion.
They did it for decades before we finally said, hey, we need some freaking labels, man.
Yeah, that's how it works.
And let's go into the next topic, which is how much does the hospital pay for these prescription pills? And that's interesting because not only are these pharmaceutical companies making money off us, there's also the hospital that has to make some kind of profit, right? So how does that work? There was a study performed by the Moran Company, commissioned by the Pharmaceutical Research and Manufacture of America, and they compared 20 different brand drugs, compared costs, and just to kind of see what is the price. So the markup on drugs was nearly 487%, this study showed. So the hospital gets the drug for this much, they mark it up 487%, and then everything is left to negotiation with the insurances. I don't want to get into the statistics of what they use, but they used cost per unit data, they used hospital charge per claim, and they did all the statistics, and the results were that the markup was up to 2.5 times more than what the drug actually costs. So not only is the pharmaceutical company making some money, the hospital's profiting on average, based on the study, 2.5 times.
Yeah, that's insane. Like, all these negotiations are done with any of your personal input. These prices are set for you, and this is what you got to pay. No negotiation. This is just how it works. And it's crazy. You can't choose what kind of medication you want. You have literally no room for any kind of opinion. You can't say you want to go on this floor or you want to go on this hospital. You don't see how much anything's going to cost you. You just get one lump sum bundle once you leave the hospital.
And especially like you're an uneducated person, like, you know, we're nurses in the healthcare system. You don't know what pill could be better. What, you know, like we described, Coumadin is like $15 compared to Xarelto. They're both blood thinners. Well, that one is like $400 a pill. Yeah. You don't know that maybe Coumadin is a little bit better because it's safer. You could reverse the drug compared to Xarelto. If you get a brain bleed, you're just bleeding out till the drug, you know, leaves the system. Yeah. And we don't know that, but the doctor just says, "Hey, take this." We trust the doctor, and we just do it.
Right. This is what we negotiated, the hospital and the pharmaceutical company, and then this is what your insurance covers. This is what you got to take. It's you take this, or you pay fully out of pocket for something that you want. And there's no room for opinion. And then a lot of these doctors, you know, it's all marketing ploy sometimes as well. So these pharmaceutical companies will dump large sums of money into marketing just so they could prove their point or get their point across without much like factual information. Like, I was on Reddit one day, and it was a Reddit post that like, what surprised you the most when you first came to the United States? And a lot of them said that there's pharmaceutical ads, you know, on TV
in the United States.
And that's crazy because they don't have them anywhere else in the world. They have them here because they could pay for the marketing, and that marketing brings them profit because they could sway your opinion. And that's crazy to think about.
We have, we're the only country that has ads on pills.
Yeah.
And we become very dependent. If you like look at patients sometimes, like, dude, they will not go to sleep unless they get their little sleeping pill, like not melatonin, what's the other one? Ambien. Like, they will not fall asleep, man. They've became so used to it that they need it. And literally, if you look at the big picture, we're a pill popping freaking country, man.
Right. And it's crazy to think about something like insulin, where there was a big issue about it being upcharged and just sold for a lot of times a vast amount of profit, where people have to come to that state where they're willing to put profits over human lives. Like you said before, people are rationing insulin because they don't have enough. You know, they save it because they can either give 4 units today and not know what's going to happen tomorrow, or they could give 2 today, have a little bit of coverage, and then 2 tomorrow to have a little bit of coverage, which is crazy.
Not knowing the repercussions because they're not doctors.
Yeah. That's the way healthcare works here.
And to summarize things, like, there isn't a perfect solution for this, but we have to basically admit the problem that healthcare is a business. There's a lot of issues in America that is basically pointing to that our healthcare system is not the best. Right. We have to start taking healthcare more seriously. We have to pass legislations that are going to allow for better healthcare coverage for everybody, right? And we have to start tackling these pharmaceutical companies, which have deep pockets in our politicians that are not allowing a government to regulate the prices, and they create their own prices.
Yeah, we've had a private healthcare system and pharmaceutical company for centuries now. Clearly, it's
centuries is like a lot of hundreds of years, bro. Decades.
Decades. Damn. Well, maybe it's been centuries. I don't know how long it's been.
Probably not, but go ahead.
We'll go with decades. So we've had private healthcare multiplayer system for decades now, and it clearly is not working. prices are inflated, people are getting charged a vast amount of money, and they can't afford it. Why keep trying to fix a broken system when you could maybe try a different alternative, and maybe that'll work a lot better? It's working for a certain country, but it can't work for us. We're the United States, we could figure it out. We can't figure out this system because it's just such a for-profit system.
Yeah.
But I believe a one-player system would probably benefit the majority of the United States.
And that's going to be a whole approach. We have to make sure our politicians are not getting paid by these pharmaceutical companies that are keeping these players in play, man. And we need some ratification, man. We need a reform. We just like with for example, gay rights, man. It wasn't popularized back in the day. People marched on the streets, protested, and things happen, man. And maybe we just have to get together and protest.
Yeah. Well, we'll see what happens. Election coming up next year, so we'll see how it goes.
Whoever listened this long, guys, drop a comment. You guys are troopers. You guys probably learned a lot about the healthcare system. You guys basically...
Sweating over here.
So yeah, you guys could probably just tell your friends and just expose the system of what's going on. It sucks. It's a real deal, and we hope that you guys learned something. Stay tuned next week. Like I said, subscribe, and keep on hanging out with us. See you guys next week.
Have a good one, guys.